Okay.
Hello everyone. Welcome to our Facebook Live, Taking Control of Your Diabetes. Of course, we got my good friend and colleague, Edelman and Pettus. And we're going to talk a little bit about COVID and diabetes. We want to open it up for any general questions. And I think it's important for all of you folks to know that Jeremy and I are taking precautions super carefully. We both work in the hospital. We're not in the deep center of COVID patients. San Diego so far is doing pretty well with that. But we are 6 feet apart. For some of you that missed the first Facebook Live, I got my trusty tape measure here. Not to make it light of it, I actually wear gloves a lot of the time. It reminds me not to touch my face. I carry around a little thing of Purell and wash my hands frequently. And I have this mask that I bought at CVS Pharmacy when I go out or close to anybody in public. So
Yeah, and I think it's also important, we're happy to do these things, but there's nobody else here in the TCOYD office. Everyone's working remotely. So we had a lot of people watch the first one. We wanted to just kind of open it up to anything diabetes related. But I think it's worth starting, Steve, with these masks, because there has been some confusion about that and which masks you should be wearing, shouldn't be wearing. What do you want to say about that?
Yeah, thank you for bringing that up, because I got confused too. So now that, at least in California, but I think everyone in this nation should be wearing a mask when they go out, if they have to go to the store or the pharmacy. Now this mask that I bought at CVS months ago, I went on a safari and they said it was going to be dusty and pick up some masks. These are not medical grade masks. They are basically just for home use. They are protective against potential virus, especially from you sending it out to the world. But I personally think too, it does cover your nostril and your mouth, which are sites of penetration by a virus in an area where someone's coughing or breathing right in your face. The other thing too is, this is my own recommendation, that glasses protect your eyes from maybe someone that's sick, that coughs, and it's in the droplets. So if you have glasses that are just for looks, or walk around the grocery store with sunglasses on, protecting your eyes is not a bad thing either. It's not mandatory, of course. Jeremy, what are you doing?
Well, I think what comes up is a lot of times people say we shouldn't be wearing these masks because we need to save them for the hospital workers. And it's important that the masks that we wear in the hospital, N95 masks and higher degree masks, are not these masks. So if you see somebody wearing these, you're not taking away from the shortage of supplies and things like that. So it's totally appropriate to have these masks, or the other things that the CDC recommends, handkerchiefs and things like that.
Yeah. They just say that I heard that you should do the flashlight test. If light can shine through it easily, like if you're going to use a bandana, then you should probably use something a little thicker cloth.
Yeah. All right, so let's get into some of these questions, and please submit these questions. I can see them live. We can respond to them kind of in real time. But we wanted to focus. Well, maybe we should start with some of the basics again, because what always comes up is I have diabetes. One, am I at higher risk of getting COVID? And two, if I do get COVID, am I at higher risk of getting complications from the virus?
Okay, I'll start off with type 2 diabetes. Having type 2 diabetes in general, you're older, typically over 35, 40, not always, but typically. Typically, you have a propensity to gain weight, and I think being overweight may put individuals more at risk. You also have the chances of having heart disease and potentially kidney disease, and these are underlying comorbidities that may put you more at risk. Now, I don't want anybody to freak out. I think we all have to be just as cautious whether you have risk factors or not. But if you have type 2 diabetes, by nature, you might be more at risk for getting it, and I think also have a tougher time recovering from it. And if your hypertension is under control, your lipids are under control, your heart disease under control, that's perfect, your diabetes, and that puts you less at risk than if they were not in control. So just be careful out there, and people with type 2, I think, by nature, are more at risk.
Yeah, I think, to be very clear, there's no evidence and we have no reason to believe that people with diabetes are at higher risk of getting the virus. It is, however, that once you get it, or if you get, COVID-19, that yes, people with diabetes tend to be at higher risk of getting the complications. But it's not that all of a sudden you have diabetes and if you get it, you're going to die. It just puts you in a little bit of a higher risk category. And within diabetes, we know that the better your blood sugars are controlled, the better you do. So somebody who's got an A1C of 6 is very different than an A1C of 12. So it's just another reminder, control your blood sugars, do everything you normally would to stay healthy, and that'll hopefully, keep you healthy with this COVID situation.
Yeah, I just want to add one more thing. There's lots of really good research showing that high blood sugars, not just one time over a couple days, but over the long term, like your A1C is above 8.5, the immunologic cells that usually fight off foreign bodies that protect you from getting infections, it doesn't work as well in people with chronically poor control. So if your A1C is above 8.59, you are at more risk for not doing well once you get the virus. It won't be able to fight it off. So that is true. And listen, the majority of people in this country are not under perfect control. That's because diabetes is tough. So no reason to panic. Just be super vigilant about all the protection recommendations.
So a lot of questions, that basically this virus is all over the country right now. But thankfully, the vast majority of us don't have COVID-19. We're dealing more with the quarantine aspect of it, being home, maybe eating differently, exercising differently. So for the vast majority of us, it's really not, dealing with COVID right now. It's dealing with all the precautions that have been put in place to keep us all safe and healthy. So maybe we can talk about, Steve, what's your quarantine life like? What are you doing, especially for your diabetes? Is your control been worse, better? Where are you at with that?
Yeah, thanks for asking. We're all different. I do go to the hospital like you do a couple days a week, but I have set up my home computer to do remote televisits, and that's really good. I saw 8 patients yesterday in my pajama bottoms, and I am lucky enough that I did buy a Peloton about 6 months ago, still making payments, and I also have a treadmill in a small room in my house, and when the sun gets clear, I really like the fresh air. I go out for a walk. I've been amazed how many people are walking in my neighborhood now, and it's a pretty wide street, so it's funny how you walk towards someone and then we separate for the 6 feet like you and I are here. So I would say I have been crazy busy. It's amazing how busy you can be working at home.
Yeah.
How about you?
Yeah, I think everybody's life has been affected, and I think that we also have a Peloton at home, thank God, so it's nice to get on that every once in a while. I'm still going to work, to do these virtual visits and stuff, so there still is some semblance of like a Monday through Friday. The weekends are different. I have 2 small kids, and last weekend we could go to the beach, so that was one thing we could do to get out, and now that's been closed. So just finding ways to entertain yourself at home. But in terms of diabetes, I'm definitely just moving less. Even if I jump on the Peloton, even if I did it every single day, throughout the rest of the day, I'm just not out as much. So I do feel like I'm becoming a little bit more insulin resistant. I think I do need a little bit more insulin than I used to.
Yeah.
In terms of eating, I mentioned on the last time, I'm trying to do this intermittent fasting thing, stop eating at 8 p.m. and not eat till noon, so I'm just like really grumpy in the morning when I wake up and I'm hungry.
I've noticed that.
Just something to try to kind of limit calories, and keep, mindful of my weight and things like that. So that's something that I've been doing, but otherwise I do think in general I'm eating worse. It's easier to snack, it's easier to kind of like order, pizza, things like that. So I think a lot of people are saying that their diabetes is just maybe a little bit more difficult to control. Sometimes just stress, anxiety, if you're not sleeping as well, that can affect your blood sugars too. So don't feel like, that you're on your own if this time is a little bit harder for you diabetes-wise. It's just important that if you do notice your blood sugars going up, reach out to your provider or to the kind of networks of ways to get back into control. So with that in mind, there's all kinds of videos online, like everybody has their own YouTube, at-home quarantine video with different ways you can do push-ups and sit-ups and things like that. So it's kind of back to basics. And then, yeah, just making kind of some kind of diet plan, whatever that is. And I hate that word diet, but really just your approach to your food and your meals. You know, if you're going to keep eating how you were, or if you're going to, switch to more low carb or whatever it might be.
I hate the first 3 letters in diet too, Jeremy. You know what? And we're all different. You got to work. You got to do what works for you. A good friend of mine said that she really felt cooped up in her house for a few weeks. She went out in her car by herself, just drove around on the freeways, and that was a nice break for her. And since she has a Camaro, she said for the first time she opened it up on the highway safely. So whatever works for you. Bill Polonsky and I did a video that's on our website about dealing with some of the mental and behavioral issues during this whole virus. And so once again, try to stay mentally healthy, stay in contact with a lot of people. What I've been doing also, I've been contacting friends that I haven't spoken to in years. I just email them, text them, or give them a call. And I'm thrilled to get reconnected with a bunch of medical school friends. So reach out to people that you really miss connecting with.
Yeah, I think that's important. You know, how do we, stay kind of mentally healthy? Because I think when this all first started, there was this kind of like, we're in this together and we're staying at home. And if there was any novelty to this quarantine situation, it's worn off, big time by now. And people are just kind of bummed and just, feeling a little bit apathetic. So again, if you're feeling that way, that's absolutely normal. And I think, just like reaching out to friends, staying involved, all those types of things is helpful. Yeah.
I'm gonna call my ex-mother-in-law. I truly love her, and I'm just kidding because she has passed away. But reach out to anybody that you really miss talking to, and I guarantee you they will be more thrilled than you will be.
Yeah, and I hear it from both types of people. Extroverts, they're hating this right now because they're not used to like interacting with people and being out there socializing or just being at a bar. Introverts, if you're crammed together in your house now with a bunch of people you can't escape, that's hard too. So it seems like people are, having different troubles with it.
Yeah.
But all right, different topic. It's a good time to review sick day rules. So what to do if you have diabetes and you get sick, and really this applies to any illness, but it's becoming again in the forefront because of COVID. Let's say, because most of the cases of COVID are mild, let's say you do get infected with that or the flu. What can you expect with your diabetes? How do you triage it? What should you do to prepare for that?
Why don't you cover like the type 1 area first? Because type 1s, we can adjust our insulin ourselves. Many type 2s are just on pills or the GLP-1 injectables, and they don't have access to insulin. So why don't you go first?
Yeah, so at first for type 1s, but again for everybody, in general, when you get an infection, it activates your kind of stress response. You get more adrenaline pumping out, more cortisol, all these things that tend to raise your blood sugars. So usually blood sugars tend to be on the higher side. However, sometimes they can actually go low, especially if you stop eating and things like that. But kind of the natural response to infection is to have higher blood sugars, which means you'll probably require more insulin to keep your blood sugars under control. Now, the thing that we worry about with diabetes and being sick is going into diabetic ketoacidosis. And that basically happens when you're just not getting enough insulin. So you need to be sure to be really extra vigilant of your blood sugars, checking very often, or hopefully on a continuous glucose monitor. This is a good time to get either urine ketone sticks, or even better yet is just to go on Amazon and get a blood ketone meter. These are meters that work exactly like a blood sugar meter. You just have to put in a separate ketone strip. But you can get 30 strips or so for $20, something like that. So they're not super cheap, but 30 strips is all you need. And then just if you feel like your blood sugars are high, you're nauseous, check your ketones. If you're over about 1 or so, that's when you're getting into a little bit of trouble. Make sure you're giving insulin up to every 2 hours and drinking a ton of fluids to bring your blood sugars down. That can be water, that can be anything low cal or 0 calorie, like no calorie Gatorade or forgetting the other ones. But hydrated
Red Bull.
Yeah, whatever that's 0 calorie. And when you need to go to the emergency room, is basically if your blood sugars are high, you have ketones, and you start vomiting. If you can't keep your fluids down, that's when you need to go to the emergency room. So these are things that everybody with diabetes should be aware of in general, but especially, given COVID. So if you have mild symptoms, if you're able to control your blood sugars, you're not throwing up, you can stay at home and, manage this fine.
You know, one of the questions that came in, Jeremy, was what if you're on Afrezza, which is the inhaled insulin? Can you still take it?
So, you know, right now, yeah, I would say take Afrezza all day long. If you do get COVID, you start having respiratory symptoms, I definitely would not. There's some questions about, you know, does COVID cause long-term lung damage? Let's say you got COVID and you recovered, could you eventually go back on Afrezza? And that's case by case, you know, depending on the severity, but in the vast majority of the cases, I would say probably yes. It's like getting a cold or a flu, that there generally is not long-term damage. If you have a severe case of COVID and have to go to the hospital and respiratory distress, then yeah, maybe I would check back in with spirometry and all that before starting Afrezza.
I was just going to add, you know, get that spirometry test, and if you really had some serious lung issues during the COVID period, you know, get full pulmonary function tests, so at least you have a good baseline for going forward for future issues as well.
So I love this one. So basically the person is saying that with everything going on, being home more, maybe being a little bit more anxious, that they notice that they're drinking more alcohol, and how to deal with that. So I love kind of the honesty of this question, because honestly, if you're working from home or not working right now, you wake up, it's kind of like airport rules, you know, it's 9 a.m., you can start drinking, like there's no rules. So how have you noticed that you've been drinking more alcohol, or and what would be your advice to people?
Yeah, I think first and foremost, you know, if you have tendencies to drink too much, if you alcoholic, if you can't stop when you start drinking, you know, you got to be really cautious. So we're all different once again. For me, I'm a pretty good social drinker, and I've been drinking more. And I sit down and like last night watching Tiger King, 4th episode, and my girlfriend and I, we make ourselves a cocktail, and we have like 3 little cocktail books that we got as gifts, and every night we're trying to pick a different one. And so I do have the big ice cube makers, so I have big old ice cubes, and I made myself a whiskey sour last night with cherry juice instead of the simple syrup.
Yeah, we did that virtual happy hour that one night.
Yeah.
It was fun. You know, so we're finding new ways to like keep connected, and you know, but yeah, I think first of all, liquor stores seem to be essential businesses, so they're still open, and obviously, you know, at your supermarkets you can still get alcohol. But I think, like Steve said, you know, if you have a tendency to, you know, go overboard with this can be a time where the anxiety can kind of lead you to treat these problems with alcohol, so you have to be aware of it. But other than that, you know, the American Diabetes Association actually has recommendations that women with diabetes should drink no more than 1 drink a day, and men no more than 2 drinks a day. So we realize that it's not that people with diabetes shouldn't drink. Just being, you know, again, mindful of it, how much you're consuming, and what it's going to do to your blood sugars. And the type of alcohol that you drink has very different effects on your blood sugar. People are always shocked to hear that in terms of your diabetes, the thing that's kind of the most blood sugar friendly is just hard alcohol. You know, and you can mix it with 0-calorie things, Diet Coke, whatever. But just, you know, vodka or whiskey or whatever, it really has 0 carbs. So it's pretty diabetes friendly. The next thing that's really diabetes friendly is wine. Very actually low calorie, low carb. And the worst thing, unfortunately for me, since what's my favorite, is beer. Especially you get those hoppy IPAs and stuff, you can get like 30 grams of carbs and can really raise your blood sugar. So depending on what you drink has different effects on your blood sugar, so just being aware of that. But the alcohol itself over time tends to lower your blood sugar. So if you're drinking a lot at night, 3-4 drinks, you might notice that your blood sugars dip overnight, so just be aware of that.
Yeah, I'll just add that worse than beer is actually, you know, if you're drinking like a pina colada or a Mai Tai, or anything where you put real Coke or fruit juices in, then that'll really jack up your blood sugars.
Yeah.
And then you're definitely not going to go low at night. If anything, you're going to go high. But I think it brings up the point that we talk about drinking and diabetes all the time because it's part of our society. Testing your blood sugar quite a bit is the best way to handle it. Sometimes if you go down, you have a snack. Sometimes if you go up, you give yourself a little extra insulin. If you're a type 2, you never let me talk about if you're type 2 and you're sick. You went straight into the topic. No problem. You know, if you're a type 2, not on insulin, you know, you have your pills. You might have an injectable agent like Victoza or Bydureon or something like that. You shouldn't be taking extra. But what you can be doing is testing a little bit more, trying to get some movement and exercise to bring your blood sugar down, trying to reduce the carbohydrates in what you're eating. So try to switch to more protein and fat and vegetables for the time being, because carbs will just raise your blood sugar. And if you start getting excessively high, you better call in to your caregiver.
Okay. Did I give you enough time?
Yeah.
Okay, good. All right. Any additional supplies to have on hand besides kind of typical diabetes stuff? Or, or in general, what should people with diabetes have at home right now?
Yeah, I mean, I think that just comes down to common sense. I would say have things to treat the symptoms of COVID or any flu. So throat lozenges for a sore throat. You might have some cough medicine to prevent you from just coughing violently. You definitely want to have some Tylenol at home to treat a high fever. And if you can get a thermometer, that's always good to have. They have them at the pharmacies.
Yeah.
And I picked one up just a couple days ago. And if I actually started saying to myself, I think you have a fever. I was freaking out. And of course I was like 96. And so, even, I think I'm pretty even Steven about this whole thing, but hey, I got concerns too. So,
yeah.
Coughing, sore throat, yeah, it may be a decongestant. That can help if you have a runny nose. The COVID can cause lack of sense of smell. That's something to keep an eye on. What else did I forget? Diarrhea. So if you have some anti-diarrhea over-the-counter meds, that's good too.
Yeah, just toilet paper, possible. Yeah.
No, I'm out. Hey, here's a question for you that I've gotten from people. Is it really good to take Tylenol to keep your temperature down or to prevent some of the symptoms? Does that prevent someone from making a diagnosis later on?
No, I mean, you should take Tylenol my take on that would be take Tylenol, bring your fever down. And, sometimes when we're screening for people, they'll say, have you had a fever, things like that. So even if you don't have it right that second, they can still put you into that bucket. I don't know if you feel different.
No, I feel the same.
Yeah.
I feel the same. I mean, obviously, take the things that keep them down, but if you end up talking to your healthcare professional, you tell them you had diarrhea and you're taking Lamodal or something like that.
Yeah.
And I think that's all they need to know.
And we mentioned this last time, but it's important to reiterate that all the major manufacturers of diabetes medicines, insulin, medications have their supply chains running, up to snuff. So there's no need to kind of feel like you need to stockpile insulin, that you're going to be running out of it. I've heard of people that have, started kind of trying to ration their insulin or test strips. We don't need to do that. You need to make sure you have enough on hand. So I wouldn't wait till the last day to kind of refill your prescriptions. Make sure that you're being vigilant about if you need refills, all those kinds of things.
Yeah, that's really important. And it also, many diabetes organizations have resources on their website. TCOYD, we have a growing resource list, and we just added Lily's $35 copay on any bottle of insulin.
Yeah.
And that's pretty cheap. They're usually over $200 you have to pay cash. So all the companies are kind of pitching it.
And then this came up because we're talking about Tylenol. People are asking again, Advil versus Tylenol. And basically this story kind of hit the news that Advil might increase the kind of infectivity, if you will, the virus based on a certain mechanism that's also attributed to ACE inhibitors, a type of blood pressure medication. So in general, Tylenol is better for controlling fevers anyways. Advil can, aside from COVID, it also has issues in, affecting the kidneys potentially. So Advil is always the safer way to go in general when you're looking for a fever reducer. This again does spill over into these ACE inhibitor medications, which are blood pressure medications like lisinopril, ramipril, enalapril. A lot of people with type 2 diabetes are on them. Please do not stop taking them. The evidence for this is really what we call anecdotal, meaning that it's not really hard and proven. So stick with Tylenol and don't stop taking any of your blood pressure medication.
Yeah, and a lot of us folks with type 1 are on ACE inhibitors too. I'm on monopril. And right now I'm just continuing it. I don't think there's enough evidence to say stop your blood pressure pill. And the other thing too is if you have diabetic kidney disease, I mean, every doctor in the world say don't ever take what we call a non-steroidal anti-inflammatory like Advil, Motrin, because that can damage the kidney. Now, 1 or 2 is not going to, but in general, it's just good to avoid those. What about aspirin?
For fever reduction?
Yeah.
Yeah, I mean, still, I would stick with Tylenol.
Yeah, because aspirin, too much aspirin can cause really bad stomach issues.
So this one, it says, how long can COVID-19 live? And I guess that means on different surfaces.
Yeah, well, it's funny, you hear that all the time. Like if you get a pizza delivered to your front door by DoorDash, they literally drop it off and get the heck out of there. They say you should, the virus can live on cardboard 24 hours, and that you should wipe it off before you open it up. And I'm not sure about that, but just remember, I want to say one quick thing about this. Even though the virus can be on a piece of glass and different items, it doesn't get passed on through the skin. So that's important. So if you touch something, open it up, take the pizza out, throw it out, wash your hands, wipe off the counter that it was on, and I think you're going to be pretty safe. Now, there's different lengths of time for different substances. So
I would just say the issue is always getting it on your hand and then touching your face.
Yeah.
So that's
like you just did.
I almost did, but I didn't.
That's hard to do. And for some of you coming on late, I sometimes wear these plastic gloves. It helps me keep my hands off my face. Now, if you have a Moscow Mule glass, copper, 4 hours. You get things like glass and steel counters. It could be up to 8 hours. Once again, it's not like if you're not going to lick these things, you're going to be okay. But that's why it's good to really go around and clean your house.
And I think that's important because it really is hours, and maybe cardboard 24 hours, these kinds of things. I've heard stories of people getting Amazon packages and putting it in their garage for like 2 weeks to kind of like quarantine their packages and stuff like that. That's overkill. So
I've heard of people getting a pizza delivery and they put it in their garage for 2 weeks. Comes out like a cracker later on. But yeah, you got to just have common sense. Even a damp rag with soap and water. This virus is really susceptible to almost any cleaning material.
Yeah.
So, just keep things clean, wash your hands, don't touch your face as best as you can.
Right. Then back to this Tylenol thing, now people are saying, what about the G5 interference with Tylenol? So kind of background is that the Dexcom continuous glucose monitor G6 has no issues with Tylenol, nor does the Medtronic or actually any other CGM. But the prior Dexcom models, G5, G4, if you took Tylenol, it could make your blood sugars read artificially high. So you might actually be 150 and it's reading 200. What do you tell people for that?
Well, I say this, if you don't need Tylenol, avoid it. Maybe a low dose aspirin, but if you really need Tylenol, you're having a fever, you're having muscle aches, then just get out your glucose meter and use that until about 4 to 5 hours when the Tylenol would be out of your system. So doesn't mean you can't use Tylenol, but as Jeremy said, don't rely on your number, because that number could be artificially high. Then you might take extra insulin. When you're not really that high, then you get low.
So this one, somebody's saying, what should I know about my blood sugar control in the hospital? If I'm on a respirator, should I be concerned about having my blood sugar controlled properly? So again, there's different stages of this disease. So most people have mild symptoms, can treat this at home, do some of the sick day measurements that we mentioned. If you go into the hospital and you're completely lucid and on top of it, a lot of places have policies where they'll let you be on your pump, be involved in your diabetes care, talk about what kind of boluses you want. If you ever get to a place where you're a little bit more lethargic, the hospital team will probably take completely over in terms of managing your insulin doses. That being said, you always need to advocate, pipe up, I have diabetes, especially if you have type 1 diabetes, they can't take you off of insulin, all these kinds of things. If you do have to go to the intensive care unit, so now we're getting to like a pretty rare situation now, fortunately, that's when they actually typically put you on an infusion of insulin, and they'll measure your blood sugar every hour and adjust how much insulin you're getting based on your blood sugar. So if you are in the intensive care unit on a respirator, that's actually a place where your diabetes is generally very closely monitored and tightly controlled.
Yeah, I agree with that. And one thing that's happened in the last week is that there was a big announcement that the hospital associations are allowing the use of continuous glucose monitors in the hospital. Previously, they weren't approved and their patients had to take them off. Then the nurse had to get out a little finger sticker and do it 4 times a day. So in order to reduce their workload and reduce contact, bring your glucose meter, bring your CGM, and I personally would bring your medications that you have to take, just in case.
Yeah.
Insulin, pills, things like that. And as Jeremy said, if you get really sick and you have to go to the intensive care unit, they will take over control for the right reasons. The most recent data I saw too, that 98% of people who get the COVID will not have to go to the hospital. So
Yeah.
the odds are good, but obviously it's a pretty serious virus.
I think, hopefully not to repeat too much, that at some point most people with diabetes have to go into the hospital, and you just can't assume that whoever's taking care of you knows everything about diabetes. So it's always good to reiterate, speak up. I have type 1 or type 2 diabetes, I'm on insulin, these kinds of things is really important.
Yeah, bring your laptop so you can replay the Facebook Live that we're doing today for your doctor.
So this says, if your insurance doesn't cover a telemed appointment, are you able to pay cash for the appointment? So we can answer that question real quick, but then we also talk a little bit about telemedicine. So first of all, hospitals always take cash. I'm pretty sure that everybody does. And I'm hoping that these visits are actually being covered, because we're obviously being kind of sort of forced to move to this venue. Steve and I did a whole video on this, telemedicine. UCSD, where we work, really actually did a pretty good job of releasing this pretty quickly, so we're all now on these video appointments. There's some positives and some negatives that we can talk about. I actually enjoy seeing patients in their home setting. I feel like it makes them more comfortable. I feel like actually it helps to kind of get to know them a little bit better. Patients don't have to worry about parking and all that, and sitting in the waiting room, et cetera, et cetera. On the physician side, it's a little more difficult sometimes not having all your support staff around. I'm used to, let's say somebody who needs to start a new medication.
You're used to bossing around the
Yeah,
nurses.
just yell at people, throw things.
Get me this, get me that.
And just help make an appointment or help this person get started on their CGM or whatever it might be. And now, since I'm generally doing these in an office with nobody around, it just becomes a lot more messaging and things like that. So I think we're working out some of those kinks. But I've also had patients, contact me and say, "Oh gosh, now it's just a televisit appointment. Should I even keep it?" Absolutely keep that appointment. 99% of what we do with diabetes, you can do without physically touching somebody. So make sure you're still seeing your provider. Take advantage of these video visits if you can, and you might actually enjoy it.
Yeah, just try to, if let's say you're a type 1 and you got your continuous glucose monitor download, you contact the office, and what's the best way to send that information?
Yeah.
Even just have it ready, you can hold it up to the camera, and that even works.
Right.
About the televisit, so you can do it by telephone call, and the UCSD is set up for the video, which I think is really good. The VA right now we're doing telephone calls, and that does work still pretty well, but I can let you know that in the private institutions that charge, the televisits are less expensive than a video visit. So if you're really hard pushed with cash, you should ask for just a telephone call, and you can do a lot on the call.
Yeah.
Now, what about Bitcoin?
Bitcoin.
Could do I'm kidding.
No idea.
What's it, Venmo? Yeah, let me send in my copay.
All right, any immune boosting foods or supplements you suggest taking?
Yeah, on our website, there's going to be a short video with myself and an individual, blanking on her name now, I'll think of it in a second. Yeah, Jody. She is kind of an expert in this. She has type 1, and Stanislaw, gosh. And the whole show was, how do you boost your immune system? And I was kind of cringing a little bit. I didn't want her mentioning a ton of supplements that are not proven, and I really loved her philosophy. The 4 pillars, but the basic thing is get lots of rest, control your blood sugars, eat foods, healthy foods, fruits and vegetables, and if you watch the video, she lists some of these specifically. Don't smoke, and there is some evidence that vitamin C may help, and I said to her, should we take vitamin C supplements? And she said no. First choice is eat foods rich in vitamin C, and if you can't, then maybe vitamin C. But I thought it was just basic common sense
Yeah.
advice. We know that good control, sleeping, avoiding smoking, and eating the right foods can really help boost the immune
Right.
system.
And it is confusing because you can go in a health food store and these things generally don't have to go through all the FDA regulations that pharmaceutical drugs do. And it'll be something and it says, immune booster or whatever. And there's basically just not the evidence for that. So, what we've said before is that if you're convinced this product works and you want to pay the money for it, they probably won't hurt you, but there's also an equally good chance that they really won't benefit you. So there's absolutely nothing that we would tell you to just run out and buy. And unfortunately, it's these things that we know we got to do. Just try to sleep, eat well, try to move, exercise. Yeah, don't smoke.
Yeah, exercise, I didn't mention that. That's key.
Okay, I'm glad I reminded you. So now, what about this? Do you have any patients with COVID? And have you seen any trends in your patients?
Yes, well, most of the patients I have been caring for are people with diabetes. They were face-to-face until recent quarantine, and now over the video or telephone call. I have had patients who have had COVID-like symptoms, and the recommendations is to stay home unless you feel you need real medical attention, and that shortness of breath is an important one to keep an eye on. And so far, all 4 of my patients that were sick, I'm not sure if they had the COVID or not. One of them lost their sense of smell, so I felt pretty confident they did have it. The rest just had like a bad flu. Kind of nursed them through it with giving advice on lots of fluids, insulin adjustment, rest, and at some point, one patient looked like they're going into ketoacidosis, and fluids, insulin, and actually, believe it or not, to take some carbohydrates that helps turn off the drive for your body to produce these ketone bodies. That's a whole nother area. So, fortunately, my patients got better.
Yeah. I think same thing. I think what we're hearing right now actually is a lot of this, well, yeah, actually 2 months ago I had fevers for a couple of days and maybe I got COVID, maybe I didn't. And we don't know. They're working on an antibody test to see if people had a prior exposure, which would actually be really helpful. But personally, I don't know. None of my patients that I treat have contracted COVID. I actually haven't even heard anecdotally of anybody with type 1 diabetes, like in the community, getting it. I'm sure they are out there. It's not like it's all in the news that, people with type 1 diabetes are, getting it left and right and, things like that. So I think it speaks to the fact that it's not everywhere, that there's still, at least in San Diego, there's not that many people that have come down with it, thankfully. And it just hasn't affected me personally with my patients.
Yeah, and Jeremy and I had to fill out a draft form if UCSD and the VA gets overloaded with COVID, that we would be going in and taking care of COVID patients. Right now, we've been fortunate that San Diego is doing a really good job with social isolation, and the numbers are relatively small, but obviously that's not the case in other cities, so it's different depending on where you live.
All right, so this question is bolded. I don't know what that means. But it says, my hands are so dry from washing them so much. What do doctors do to not have such dry hands?
Well, I did buy, like 6 months ago, I had cracking in my fingers, the skin. I bought some heavy duty hand lotion, probably marketing just for hand. It's kind of thick stuff, and what I do is I put some on, then I put the glove on. And then that actually allows it to really soak in. Now, you may not have plastic gloves at home, but I don't believe there's a short supply. Even dishwashing plastic gloves that you buy to save your hands when you wash dishes. And believe it or not, even some of that Purell stuff, even though it may have a tendency to dry out your hands because it has alcohol, putting some hand lotion on in between is important. How about you, Jeremy?
I haven't had a problem so far, but I think if I did, I'd just start with just a little bit of lotion.
I thought you were using Crisco oil.
Yeah.
That stuff works actually on your hands.
Okay, so let's see. This is kind of back to the mask question. It says, what about the cloth masks people are making and we see all over Facebook?
Yeah, maybe we can just repeat it real quickly. Any cloth mask is appropriate. I heard today that if you can shine a light through it, it looks really bright on the other side. It's probably not enough tightly woven. I also got this mask at CVS Pharmacy. It's not a hospital grade mask, but it's perfectly appropriate to go shopping.
Yeah.
And so I think it's a good idea. Let's just say that you're sick and you cough, and it just prevents all those droplets from going out into the immediate area.
Yeah, it really is a good idea. So finding something to, protect other people around you, just when you're out, if you are in public, putting one of these on, I think it's important that we all kind of do our part for that.
Yeah, I don't know if you've seen all the internet jokes, but people are taking like tighty-whitey underwear and putting it on your head, moving it back behind your ears. I mean, yeah, whatever works for you.
Yeah, I just noticed that my iPhone doesn't recognize me when I have a mask on. So that's first world problems I guess we can get around.
Yeah.
Okay, so that's most of the typed in questions. Are there things that you wanted to
Well,
talk about, or?
I'm just thinking out loud. Yeah, I think we can just reiterate a little bit and then we can finish up.
Okay.
About the safety concerns. I know people are watching Facebook Live from around the United States and possibly outside. I really think that my closing thoughts are, I think we're starting to see the curve flatten a little bit. Remember that people get really sick about 2 weeks after they present with cases, so even if you see a lot of people passing away or entering the ICU, the number of known cases seem to be going down, even in New York City, if you can believe that. I think the strict social isolation is key. Stay 6 feet apart from people, stay at home unless you have to go out, and if you have to go out, make sure you wash your hands quite a bit, use Purell, put a face mask on. If you have plastic gloves, that's a good idea too. And I do think the more strict we are now, the faster we're going to go back. And I don't invest in the stock market, very little, but when you see the stock market coming back, it means that the investors are feeling confident that things are turning around. And I predict, don't invest in anything I tell you, but I do predict that we're going to have a much greater robust recovery than we did after like 2008 and we had that crash.
Yeah.
So just be vigilant, and it's short-term hassles for long-term gain.
Yeah, and I think, again, this virus, it's affecting every aspect of our lives, socially, who we can see, who we can be around with, with work, with financially, all these stressors, and having diabetes is potentially just one more stressor on top of that. So I'm hoping that just having a conversation about it, realizing that, the chances of you having a serious complication from this is actually really small, but a good reminder to stay on top of your diabetes, get healthy, get under better control, maybe, use this negative as a potential positive to take control of your diabetes, stay on top of it, reach out to old friends, all these things that maybe you haven't had time for, and we'll get to the other side of it. And I can't wait to sit next to you at a bar and give you a hug and do the things that, that we used to do.
That's the hardest part for me.
I know, that's when people say, what do you miss? It's, I am actually pretty introverted, but I miss being around people and just sitting at a bar or wherever, at a restaurant, just having kind of people around, but we'll get back there.
Yeah, try to find a silver lining.
Yeah.
Anything that works for you, and I think we're going to learn a lot about how our society should be run that we may continue after. I just want to mention that on the TCOYD site, we have 3 Facebook groups for people with type 1, type 2, and those of you significant others, the type 3s. We have all the resources, and the other thing that's really important, we answer every question that goes to our blog. Lynn over at TCOYD, she answers the easy ones, the doctor ones, she'll send to Jeremy or myself, and we do respond to everybody. So if you have a question or comment or concern, just go to our blog and send it in.
Yeah, and then on the website also on the top, there's this thing that says TCOYD video series, where we've recorded a lot of lectures that we've given over the years on pretty much any topic you can think about, diabetes related. So this is also a time that you want to brush up on something specific, Afrezza and type 1 diabetes or whatever it might be. There's a video for that. So stay happy, stay healthy, stay sane, and just know that we really are in this all together. And at TCOYD, we're just trying to think of ways to keep you guys educated, informed, and a little bit entertained. So Steve, it says I'm supposed to end here with that you're going over to the Lions Club Facebook and you're going to go live with them.
Yes.
So feel free to join and continue the conversation, and we will post the link to our Facebook page.
Okay, well, okay, so long nation, and we'll give you the high five from a distance. And thanks for tuning in, and stay in contact.
Yeah, now I'm going to waddle up here and turn this thing off. So bye, everybody. End.